Running an ambulatory practice today isn't simple. Leaders are balancing patient care, staffing pressures, financial performance, and rapidly changing technology all at once.
Welcome to In Practice, a podcast focused on the latest in ambulatory care, what works, and what leaders need to know to help their practices thrive.
Hi, I'm Jenna Hagan, Vice President of Product Marketing here at NextGen Healthcare, and this is In Practice, a podcast where health tech leaders, clinicians, and practice administrators discuss the challenges ambulatory healthcare practices face every day. Today, I'm joined by guest Sloan Clardy, thought leader and industry expert in the RCM space who's been thinking deeply about how AI, payer pressure, and workflow fragmentation are colliding, and what it really takes to move toward a more connected end-to-end revenue cycle. Welcome to the show.
Great. Thank you, Jenna. I'm excited to be here. Appreciate the invitation.
Yeah, absolutely. Well, I'm really excited to dig in with you today. And with your experience, spanning RCM operations, growth leadership, board governance, you've really had that front row view into how the industry is balancing the push for AI-driven innovation, that need for operational rigor, but most importantly, that need for real measurable value creation. Talk to me a little bit about your experience with technology and how much it's evolved.
Sure. Be happy to. And, you mentioned AI expectations. They're certainly at an all-time high right now. For me, I've been in the space in RCM and technology for about 30 years now. So I'm able to reflect a little bit more from a historical pattern. And, it like the rest of healthcare, RCM has longstanding challenges, some of which I know seem odd to outsiders looking in. There's big picture questions I think are relevant here as we explore AI. I mean, one, why can't we have more real-time adjudication in RCM? Why aren't there more standardization efforts across contracts and pricing and reimbursement terms? And why do payer rules change so frequently? Why not more data interoperability? So all of these fundamental issues and challenges, I've seen us grapple with for the last 30 years. Historically, we've tried to apply consulting and data and software and services to try to help solve that. None of the problems are new, but the technology that we have now is certainly more viable than ever. So, if I reflect on a little bit of the technology cycles, to me in RCM, there are probably at least three big ones that I would highlight as we look over the last 30 years that bring us to where we are today. First was, late 90s, probably to early 2000, up to 2010-ish, where that was sort of the advent of standalone RCM functionality and technology. We brought software to the industry to automate more manual processes. Quite frankly, at that point, EHRs and practice management systems didn't have much RCM functionality. We started adopting rules-based systems, and it was really about best of breed functionality at that point. So it was an explosion of a lot of new softwares, charge capture software and claims scrubbers and contract management, charge master and compliance tools. All of that was, really coming onto the scene. And then, probably the second phase, if we started somewhere around 2010, maybe up through 2020-ish, was we tried to start connecting all these systems. So, a key challenge in revenue cycle is that it's truly a system of systems. And we started to see more native RCM capabilities within EHRs and practice management systems, albeit it was still largely a lot of batch and maybe some HL7 integration with third-party systems external. But we really started grappling with how do we integrate functionality between clinicals and financials and with third-party systems. So, there was a lot of effort around technology toward integration and, less fragmentation as well on. And that takes us up to, I think, where we are today. And, so somewhere around 2020 to now it's all about intelligent automation. And, we're really starting to converge the technologies that we developed in the past with new technologies that help us speed the cycle, become more predictive and automatically fix things without intervention. We've moved toward real-time APIs And, it's not just AI. We talk a lot about AI, but, several years back, we really started leaning heavily on RPA, the digital hands, if you will, to automate more repetitive manual tasks. We've added a lot of machine learning so that we can apply data science to these patterns in RCM data and get more predictive. Intelligent document processing is a huge one because, all of these paper-based and manual forms, faxes, policies, et cetera, we're now able to ingest them, classify them, and extract data in an unstructured document manner, which we just couldn't do before. So, that really opened up a lot of capabilities. And then more recently with LLMs and agentic AI, we're at that point now where we've kind of got the digital brain that enhances reasoning. And that is a whole new capability for us to expand the reasoning engine, if you will, within RCM. So, I think there's a lot that's evolving, and complexity is going to remain part of the system. But, how quickly we can identify the patterns and act on them now is different.
Yeah, that's so great. There's so much pieces in there that I'm excited to unpack. It's definitely
Sure.
been an incredible evolution. There's a couple pieces in there that, just prior experience working in organizations when you spoke about paper and, as technology advances, as AI driven as we are, vaccine, paper, healthcare still remaining to be antiquated in those pieces. So we'll unpack that here in a little bit. But one of the pieces I wanted to dig into is what do you think about the market momentum with AI? What do providers want in RCM specifically with AI, and what's most being used today?
Thank you. I think it's important to kind of ground, a lot of what's written about the industry is very forward looking. And, I think that's great to have the vision out there, but grounding in reality of where we are today, I think providers simply, they're trying to solve those fundamental problems we talked about before. It's about speed, transparency, defensibility, not new problems, but, how can we do more with AI and other technologies? So the key things I hear most that providers are looking for is, help to suggest next steps around payer workflow. We've tried to codify a lot with rules-based engines in the past, but we miss context. We miss things that are important. So using AI to help suggest next steps is a big one. Definitely, I think we're probably most in the co-pilot phase right now. So we're speeding creation of routine content and forms and whatnot using AI. That's the other big bucket. And I'd say the third one that is evolving is AI for more predictive purposes. So anticipating what are the future needs of either payers or patients, based on information that we have. So again, I think most of what I'm hearing right now is focusing on AI as enabler. This is not a replacement for human involvement yet. It's very much a human in the loop co-pilot phase right now, I think. Where is it being used most, you asked? I would say, first a level set. While I'm excited as most around the idea of a fully agentic RCM platform that has end-to-end orchestration from the front all the way to the back end, that's just not yet a market reality. You know, I think we see meaningful components of that on the horizon, but certain vendors are probably better positioned to deliver that than others. For now, it's mostly, I'd say, functional area reasoning engines, and some specialty specific use cases. So, a lot of adoption around ambient listening and documents support, coding and CDI for sure, coding suggestions. Some of the more advanced ones are starting to solve for, looking at leveling, not just code assignments, but some exciting stuff evolving there. Prior authorizations for sure, we're starting to apply AI toward that problem. Denials, appeal, automation, back to intelligent document processing, payment posting, and reconciliation. And then finally, I would say AI voice agents, both for interaction with patients as well as outbound follow up with payers for status and et cetera. Those are probably the six big categories that we're seeing most adopted right now. I would say, I think there's huge untapped potential when you think about areas that aren't yet figured out fully, or there's low adoption in the market. Payer management reasoning engines is something that I've thought a lot about, and have worked in that contract management space in a prior life, and so I think there's huge opportunity to apply AI there to support contract management negotiations, underpayments, real-time payer policy management. So that one's largely untapped. Pre-claim denial prevention, is another area I would say, using agentic AI to help plan and act and learn across, not just a single agent, but multiple is going to be hugely impactful. And then a little further out is that AI orchestration that we talked about, both, within and across the revenue cycle. That Yeah, a little bit further out on the horizon, but it helps us address this issue of the RCM system of systems, different software platforms, different sources. So that one I think is the other big untapped one.
Yeah, that's great. There's a couple things in there too. You mentioned the fear of replacing humans or providers or staff with AI, and you still need that human in the loop. That piece is incredibly important. AI is helping to drive down cost of ownership for organizations, speed to impact, speed to efficiency, speed to cash. And as the systems continue to connect, there's a lot of really important benefits that we'll untap here in a little bit. But who benefits most from AI, the payers or the providers?
Yeah, I wish I knew at the end of the game. I think it's pretty clear that, in my estimation at least, that both will benefit a lot. Um, I think it's reasonable to anticipate there'll be some form of an AI, warfare that happens between the two, but both are really trying to, improve cost, reduce workload, faster processing, become more predictive. Um, I think it's reasonable for both parties to anticipate that there's, up to 30-50% of manual tasks that, today we haven't automated that we can in the future, that will allow us to focus more on exception-based cases. I would think for providers, probably the front and middle end of RCM is going to be relatively more impacted by that. But I think it's a huge opportunity to reduce workload, faster processing too. I mean, that in concert with APIs and real time processing, we could see 30% faster processing, I think. And then accuracy, crossing my fingers, is maybe the biggest benefit.
Yeah.
With clean claim rates, and better yet, first pass payment rates increasing, hopefully, further into the 90s. So, I think those are the order of magnitude of the benefits. Either way, I would say providers are going to need to adapt if they're going to capture their fair share of those benefits. A few areas that I've thought about for sure is, there will be more requirements to prepare data, execute workflows, capture documentations before the claim is ever submitted, as this naturally evolves in the industry. So, providers are going to have to, adopt that mindset. I think they're going to have to redesign processes and roles and responsibilities within RCM. So, the definition of what a task is, the role of a human versus an agent, orchestration, as we talked about before, and then definitely compliance and security, I think, have new ramifications. So think governance is going to be more critical. Um, One thing that I can anticipate, hopefully we don't have happen, is that, this proliferation of AI agents without the right context and, steering and, orientation could be a recipe for chaos.
Yeah, for sure. That was one thing I was going to circle back to, as you mentioned accuracy and the importance of it, and having the human in the loop for that, submission, that review. Let providers still be providers, but let
Yeah.
them edit versus completely author the workflow. We could probably spend a whole episode alone on the ethics of AI and the accuracy of AI, but just as much as accuracy is important, so are the conversations when I work with organizations and the market, is just understanding, partnering, and valuing with technology that understands ethics, making sure that AI, has the appropriate bias, guardrails, and measures, and that there's organizations with the right telemetry and auditing and showing how it got to where it got and how to correct the accuracy is just as important. Do you have any thoughts on balancing that innovation with that operational rigor and that measurable value creation? When we talk about AI, there's a lot of point solutions out there, and there's a lot of high expectations for the outcome and the impact and that value. And, MIT did the study where over 40 billions invested in AI. It's point solution. 95% of them are not failing in AI working, but they're failing in measurable outcomes because they're expecting end-to-end workflow creation and impact. So, do you have any thoughts on how to balance that innovation with that rigor and that operational expectation?
Yeah, it absolutely gets back to not getting too caught up in the hype and, taking your eye off of the key metrics that are most important. So, I think what remains constant in the go forward world is the challenges are still going to be on improving revenue yield, accelerating cash, managing your cost to collect. And, at the end of the day, there's no shortcut to that value creation. Keeping your eye on the right metrics, it'll still be cash and AR days and denials and write-offs and productivity and all of that, and trending it over time. Where I think, it really helps in order to make sure you're capturing the value in some of these use cases and new technologies. Keep your eye on consistency and predictability of your revenue cycle, not just the KPIs, but the consistency and predictability of those over time. Um, you know, in RCM, predictability is easily as valuable as productivity. And it's one thing to accelerate, cash for a couple of months or reduce AR days or, any particular metric. But if you step back and just make sure you're evaluating consistency and predictability over time, to me, that's the lens you have to keep on, each of these use cases. That said, I think we are very bullish around the impact that new AI technologies are having in revenue cycle, probably more so than many other industries or even segments within in healthcare. So I think if you double click within our world, you really can measure a lot of the benefits.
Yeah. Circling back to those expectation pieces, a really great example is prior authorization, right? There's a lot of technology saying we've got it, no touch, solving it end to end. And the reality there, even going back to the payer, the provider, and who benefits, is there are some clear guardrails of solving your specialty space or your market or your service lines.
Yeah.
There's a lot of nuances within your specialty and the services you provide. And while you may have some payers that are quick automated authorization, connectivity, you still have others that require clinical record. And how does the technology know what clinical record to attach and when to get that? And so really having an understanding of what are you trying to solve? What can we gain out of the efficiencies and the improvement of what is available today, knowing that there is and should be still some human in the loop intervention in some of these critical pieces that are touching those patient workflows.
Yeah. No, I think you're spot on. And a lot of this is clearly defining the problem and expectation management, as
Yeah.
well. You're right. What I've seen, especially in the prior auth space is the differentiation right now comes down to payer connectivity and service line coverage.
Yeah.
Are they can a vendor cover 50 to 80% of your CPTs? Can they get to some of the harder stuff like, infusion or rehab or cardiovascular high cost services? Can you integrate that with the referral process and prior auth? It's back to that. Keep your eye on the big picture, KPIs and the impact to it. I don't think back to the proliferation idea or assembling, 20 more point solutions necessarily, solves a lot of problems for us. So I think you're right. You got to make sure you're clear eyed on what is the goal and what are you trying to improve.
That's exactly right. We've talked a lot about how much the industry's evolved in the past 30 years, right? If we looked at it chunks of decades at a time, I kind of want to hone in on just the last year. The AI momentum has just been at a rapid pace, high pressure, high expectations, high hype. And I'm just curious if there's one piece that feels fundamentally different for you from 1 year ago to now.
Yeah, it's a great question. It does kind of feel, like there's many evolutions right now, and maybe the revolution in the last year is probably expanding the reasoning problem within,
Yep.
RCM engines. It's become a lot more dynamic, a lot more sophisticated. Definitely is shifting from reactive to more predictive. So that's probably the single item where, I mean, we're seeing really good tangible examples of that in denial appeals, for example. So that does feel different to me today than yesterday. I think there are fundamentals that again aren't changing, and then there's double clicking on that different piece. There's a lot of things that I'm watching closely. Fundamentals, payer information systems and contracts are going to still have a bunch of variability. So that information asymmetry and complexity, it's going to remain, and friction between payers and providers is going to persist. Both intentional and unintentional. Hopefully there'll be a few more areas of payer provider collaboration that emerge with the technologies, but um, the RCM system of systems challenge, I think, our new technologies can help with it, but there's still be no single entity or technology that can complete the process alone. So, that's going to remain. I think, you know, um, the AI as an enabler as opposed to, a replacement for human involvement. Absolutely expect that that's going to persist. But, on the differences, probably the two biggest things I think about, one is the explosion in volume and type of information that we're using in RCM. Um, I don't have precise numbers, but I think we're absolutely moving from terabytes to petabytes of annual data, so 1,000x increases, and that's more structured data, it's more unstructured data, it's machine readable, machine unreadable, it's pricing transparency data sets now, it's behavioral context, inferred data, and then newer things is contracting evolves with population health, remote monitoring, all of that. So it's exploding, and what do we do with all of that? I do think there's more information and there's more requirements now to cleanly adjudicate claims. We're seeing evolving payer rules and heuristics that require more granular data. you know, Another one that I would highlight for you is just a really big one I think that's evolving is billing data increasingly has to tell a story, a complete story. It's much less choppy and transactional. So there's more documentation that's required. It's not just traditional procedure and diagnosis codes. Think almost show your math moving forward while you tell the story. And some of that we've seen for a while, like adding comorbid conditions, social determinants of health, but the new prior auth packets that we're starting to see evolve with clinical evidence required. The new wiser model from CMMI is a great example to think about, where they're testing AI enhanced prior auth and prepayment reviews for traditional Medicare. If you think about that, it's not just about clinical care, really. It's more about making decisions more traceable, reviewable, defensible, back to those big goals of RCM throughout the whole process, before the physician orders to scheduling to subsequently RCM. So you're almost introducing a new intermediary there with the AI technology. But if you're not prepared to show your math more and tell that story, we're going to end up with more rejections and more denials. So those two I think about a lot. There's definitely going to be more data tools and connectors, with the new CMS regs and model context protocols that are emerging. But those two, sort of explosion of data, and then what's going to be required to cleanly adjudicate are probably the big ones I think of.
Yeah, those are great. And, that piece about it needing to tell a story is incredibly important. I think, too, as organizations try to pinpoint a problem that they're solving, they forget about how there are pieces of operations that tie into that story. For example, upstream, front end operations, and downstream. They think, okay, I've got a high denial rate. I'm going to solve for denials. How do I solve for denials? And they forget about that front end upstream process where it starts at appropriately capturing insurance? Do you have the right technologies helping to identify the insurance or additional policies available? Coverage gap. I mean, it all starts from there. And there's a lot of organizations that kind of forget those other low hanging fruits that are connecting the different processes because it is a story that's end to end. I think that's one thing that's super important too is the market momentum and pressure of AI and the hype around it. A lot of conversation around system of record, moving to system of context, but the importance there of contextualizing and connecting the story, the pieces of data that are really important. But what are we going to do about it? The technology's driving that individual, that employee, or that patient into action versus just saying, here's the data and what I think is going to happen, right? Because we have that today, but we're asking humans to go look for data in certain areas and know what to do with it. So yes, surfacing it up like denial predictability is great, propensity to pay, but what are we going to do about it? What are we going to recommend? How are we going to action them to adjust it and fix it? I think is really that important piece.
Yeah, and now to your point, I mean the context that we create with that too is huge. So AI is not just going to observe the process, what happened, but it's going to help us figure out why it happened, including those upstream registration behaviors or payer nuances or whatever it may be, timing issues. It's understanding not just the data but intent and what's urgency, and so all of that I think is what there's new potential for that we didn't have before.
Yeah, absolutely. I think too, we've talked a lot about tech forward and AI advancing us in the industry. RCM's leaned very heavy on services offerings, right? Having that human in the loop to know to find the data, use the data, action on the data themselves, because over the past 10 years, technology hasn't, promoted that or prompted that. Do you think the industry is moving away from services only? Do you think it's going more towards end to end? What are your thoughts there?
Yeah, I think it's evolving. I would call it probably more of a restructuring, not moving away from services per se, but the traditional model of services first, manual, labor intensive outsourcing, or you know business models that are transactional or per head. I think that's very quickly evolving to tech enabled or tech first. And, definitely, you're seeing more adoption of outcomes driven partnership models. Um, AI will eliminate at least some of the labor arbitrage model that we've had in the past and, scale efficiency advantages perhaps. But, I do think there's still going to be a place for thoughtful, services models. As we've said, human in the loop is going to prevail. I believe, probably be 80% of the, high volume transactions are tech enabled. Many of them already are, right? Especially in certain components of RCM, but, it'll be those, 15-ish% of complex rules that complex cases, exceptions that, will still human in the loop will be important. I regardless of whether it's the tech first or services first models, everybody's heavily investing in agentic AI right now. If you don't, you're going to be left behind, and I think there will be a thinning of the herd within the RCM vendor ecosystem in that regard. Big picture, macro level, I do expect tech first solutions to grow relatively faster over time. I think that would differ by provider segment. Some it wouldn't surprise me for some segments to see tech-enabled services to continue to grow pretty fast because there's going to be more gaps internally and inability to invest in some of this new technology. At the same time, we'll probably also see the emergence of more of a hybrid RCM tech services model. Think a core technology platform, hopefully with a nice orchestration layer on top of it, with optional service wrappers that providers can exercise as needed. So it'll be interesting to see how it evolves. I think they'll absolutely still see growth in RCM, both for services and tech. Perhaps tech, first starts to grow a little bit quicker. That'd be my view.
Yeah, I think that's exactly right. The reality is that you've got the specialty space where you have the service line options that are complex. You're going to need that end-to-end workflow with the services component. Or you're large enough or small enough, right? There's just those mixes and percentages of having that uplift. And the reality is regardless of tech company or a client yourself running a healthcare organization, we all have margin pressure, scalability pressures, and just things that services alone can't solve, tech only alone can't solve. I think that hybrid model is exactly where true orchestration, true end-to-end, true workflow will really lend its hand in success. Um, are healthcare systems still thinking about best of breed solutions, or are they prioritizing more unified, or are they just looking to quickly go in on that point solution or fix that one problem for me? What are you seeing?
Yeah, this is a little hypothesis because again, I think you're still seeing pretty good growth in both models. But yes, to answer your question directly, I would say I would definitely expect to see a more unified model have more value attached to it. Especially with advances in agentic AI, we get closer to that full RCM orchestration layer that we talked about. There's just so much power in a unified model. Per your comment a second ago, a lot of it depends on the provider and their circumstances. Size of the provider, talent availability, revenue complexity, like you said, your payer, the regulatory impact in your space, how much specialization is needed, definitely your core IT stack. So, all that I think comes into play. What I would think about, for the best of breed solutions, which, again, specialization is always going to have a place in healthcare RCM as long as it delivers a differentiated outcome. There are segments of RCM, take complex claims, for example, that it's just different than, regular payers and claims. And so, what I would be thinking about a lot for the best of breed vendors is how will you complement the reasoning abilities of, the provider's RCM system of context and system of record. So, again, as we start to get to a point where there's these orchestration layers, how are you going to plug into that? And do you bring data, insight, algorithms, value that sits outside of the core data that sits in those, systems of record? If so, I think it can still be very complementary. There's going to be a need to adopt MCPs and APIs to plug into that, but it can still be very additive if you think about it that way.
Yeah, that's great. So I have one more question. It's kind of a big one, but I'm just curious. With the market moving at a 10x speed, if you will, AI, payer pressure, models emerging, all the things. If you're a provider, an operator in a healthcare organization, what's one thing that they should focus on or make that shift towards to really have that tangible difference, not just incrementally move the needle for them?
There's so much to consider now. I could probably comment on a few areas. If I really step back and ask, how can we improve revenue cycle at this point in time? Especially considering the new agentic capabilities that are emerging. I do think that adding more targeted, both clinical and payer reasoning capabilities is perhaps the biggest overarching theme for me. And making sure that that's embedded within our workflow, not again a a new bolt on or a set aside that is just going to add more complexity. And, you know, it's really gets back to that expanding the aperture of the RCM reasoning engine in a practical manner. There's been a lot of investment and progress, quite frankly, in clinical reasoning engines applied to RCM, obviously medical necessity criteria, and marrying that up with activity in the chart. And the early returns on that around, denial management in particular, are really positive. So, I think that's one area that I'm excited about the progress in the market. I would say closely adjacent to that, but not yet developed, is more of that advanced payer reasoning. So, that includes payer contracts and policies and correspondences all the way into, employer benefit plans, historical, payer payment patterns, the new published market pricing data, both on the payer and the provider side. Yeah, it's harder because some of this information isn't as readily available as just looking inside of your EHR, right? But it is equally important, if not more so, toward clean adjudication, higher speed, more transparency, et cetera. So, with Gen AI and our ability to scour millions of pages of documents, a lot of them being unstructured, to find that missing information, add the context, anticipate denials. That's where I'm looking, off in the horizon a little bit and excited about, more advanced payer reasoning. My hypothesis is that payer contracts are going to get more complex looking forward, not more simple. And so we need to manage those concurrently, not just in a, one-time episodic event. And we got to rethink how we write those contracts. There's already so many challenges in how many of them are written, but think about what's going to change as we go forward and how you need to evolve, your contracts so that they're more operationally feasible for both parties to adjudicate. And, look, there's no doubt that payers are going to continue to invest heavily in, AI systems. So we're going to need more high dimensional data to handle those complex payer contracts. And in some ways, we're going to have to use technology to manufacture more billing transparency. So that's probably what I think about as far as rising importance and, what's going to be more than just incrementally. It's, more real-time detection of, policies and payer reasoning and reconciling that against contracts. That's what I think will really rise in importance.
Yeah, that's great. And that's super helpful. I think we barely tapped the surface here. We could probably unpack a lot of this for hours. But I think it's been great to just help us level set on expectations, the hype versus reality, and help to remind organizations to find that low-hanging fruit, that impact to drive, improvement into the organization and focus on that area while they're partnering with these vendors that are going through this transformation of driving in orchestration layers and true agentic AI, connecting the workflows. But it's been a wonderful conversation. I really appreciate you joining the show today. Thank you so much for your insight.
Yeah, thank you for having me. I enjoyed it.
Yeah, this is great. Listeners, thank you for making time to join us for today's episode of In Practice. Be sure to subscribe on Apple Podcasts or Spotify to never miss an episode. Until next time.